During the past few decades, car manufacturers have increased vehicle efficiency and people have become more conscientious of their driving habits. So, has air quality in the tri-state actually improved as a result of these changes?
Looking at air monitor data in Evansville, we can see that black carbon particulate matter is impacted every day by vehicular traffic. The US EPA has found through air quality control programs that emissions of black carbon have been reduced over the last 10 years and are expected to be reduced even more from the mobile sectors between now and 2050.
We have on our website what's called a trends report, and it covers 30 years of monitoring data. And for sure, the monitoring data has decreased over that period of time. You could even see it over the last 10 years. Various programs that the federal government has instituted has brought those emissions down, and they continue to go down.
So our air quality has certainly improved over the last 10 years, and even more so the further you go back in time. Right now, I think a big part of that is the fact that we're getting the word out as far as what are the things you should do and shouldn't do. I mean, air quality has been incredibly good the last few years. We have had 819 days since our last ozone exceedance and 1,160 days since our last particulate matter exceedance. And so we're looking at more than a couple of years for each one of those, and that's fantastic, especially in a river valley surrounded by what we're surrounded by. So I think we're doing a pretty good job.
The better air quality in Evansville, Southwest Indiana, and throughout the United States can be linked to improved air quality control, air emissions control on vehicles and industry.
I would characterize the air quality in this region of Indiana as good, in fact, very good. And the measure that we use, or the test that we use to determine that, is whether or not the monitors that are in this region are below what the National Ambient Air Quality Standards, and all of them are. So we're actually doing very good.
Overall, there's been a 30% reduction in ozone and particulate matter levels. For the daily PM 2.5 design values, they declined from an early value of 40 to 26 micrograms per meter cubed. Over the annual standard, the design value went down from 16.7 to the current level of 11.4.
30 years ago, when the Clean Air Act first came out, what was regulated was what was called TSP, which is total suspended particulate. As the Clean Air Act evolved into the 1990s, what became more important, and we realized through scientific investigation, was that the smaller particulate was more important because it got absorbed into the lungs. It went from TSP down to what's called PM10. And PM10 means particles the size of 10 microns or less. As time went on, more studies were done, and it's been determined that even smaller particles, what's called PM 2.5, fine particulate matter, is even more important, and it's those that get absorbed into the lungs, deep into the lungs, and affect people with asthmatics, the elderly, children.
So the Environmental Protection Agency has monitored the impact of air quality and pollution over the past 30 to 40 years. And over the past few decades, we've seen that the improvements in air quality have prevented a number of health conditions. First, it's led to a significant decrease in premature deaths, not only in adults, but also in children. Second, it's led to a significant decrease in a plethora of other health conditions. So it's decreased the number of cases of chronic bronchitis, number of cases of asthma attacks, and also the number of cases of acute myocardial infarction. So collectively, the EPA estimates that over 2 million cases have been prevented. We've also seen reductions in ER hospitalizations due to respiratory conditions, and also we've seen reductions in the number of work days missed with respect to adults, and also the number of school days missed as well.
Obviously, when you have less exceedances as far as ozone and particulate matter go, generally you have less reported issues of asthma or complications from heart disease. And so, I mean, it makes it easier. You can spend more time outside, you can get more exercise, you can enjoy your community more if the air quality is good and you don't have to worry about whether or not, oh, is my child with asthma going to have an asthma attack if we're outside for too long. And so being able to keep those days down really does help improve overall health.
It does affect our health. It affects our everyday lives. We have what are called National Ambient Air Quality Standards, and those standards are broken down into primary standards and secondary standards. The primary standards are designed to protect human health. Secondary standards are designed to protect our environment. Both of those are equally important, and we want those standards, and we need those standards.
Federal regulations as far as our overall efficiency for cars, I think that's something that's certainly helped out a lot. I also think that there have been some federal regulations put in place for power plants that have done a good job. And I think it's a matter of getting information out and getting people to understand why it's important. And I think we've done a good job with that. And I think people really do understand that it's a very important part of being a member of the community is to take care of the air.
All of the monitoring data that we collect in the entire state is on our website, www.in.gov/IDEM. And you can find all the monitoring data that is collected there.
Air quality data from around the country and Evansville, including air quality forecasts, are available on the US EPA website, airnow.gov.
My advice would be to pay attention to the information that you have available. Go on our website, look up the monitoring data and see where we stand. And if we don't stand, if we aren't where you think we should be, then make some noise and contact some people.